The Rhinology Room. Conversations beyond guidelines.
Hello, Na.
Hello.
You forget your phone.
Oh, thank you. Oh, okay.
Sherry keep it for you.
That's my script. Welcome to the Rhinology Room.
Welcome.
Okay. Today we're going to talk about a missing piece in rhinitis. Right?
What is?
What is it? What do you think it is?
So when the patients come to us saying that they have blocked nose, they have runny nose,
Yeah.
and one thing is when we see diagnosis, we notice that it's quite congested nose, and we think that wow, severely inflamed, but many of them do not have inflammations.
Right.
It's a neurogenic pathway, which is the missing piece that you mentioned.
So I think the neurogenic pathway in the nose is actually underestimated the impact that it has on the symptoms of the nose, right? Yeah. So what is it, the neural pathway? Why is it so important?
One thing is, most of the times, the patient may say to you, that is very bad when they exposed to the aircon. When it's raining, the weather change. This is not allergen at all. Or especially when the air quality is quite poor. And they show the mobile phone that showing that the elevated concentration of particulate matters.
Right.
And they say that the symptoms are worsening. This is not allergen, right?
Right. Yeah. So you think a lot of people still understand that they have allergic rhinitis when actually they don't have it. It's a totally different entirety, right?
Very
it's actually,
common, actually.
Yeah, it's very common. So
do you experience the same?
Yes, I experience the same thing. So I think most patients are very they just think they have allergic rhinitis.
Yeah, interesting. Because you say rhinitis. What is the meaning of rhinitis?
True. I think the term itself is already misleading for this kind of patient because the term rhinitis is actually inflammation, right?
Of the nasal mucosa.
Of the nasal mucosa. But when patients are suffering from non-allergic rhinitis, it's actually not inflammation, right? And also the neurogenic neuritis is not inflammation.
Vasomotor rhinitis.
Yes. So I think the term itself already misleads a lot of us.
Right.
Yeah.
Right. And when the doctors consider inflammation, they give anti-inflammatory agent, right?
Steroids.
And the patients are wondering, they
don't get better.
Right.
So I think there's going to be some patient who get better because sometimes they actually have non-allergic rhinitis too. But there'll be a group of patients who doesn't respond to the medication or maybe respond not well enough, and then that little remaining symptom that's still bothering them is coming from neurogenic.
Yeah, this is very good point. One thing is, all patients have nerve.
Yes. They won't have nerve.
They have vessels. They have glands. Right. And they also have immune. Right. So we should think all together, right?
Yes.
Even the patient who have allergy test positive, they also have the nerve, right?
Yes.
They also have parasympathetic, sympathetic, right? And one thing is the 1/3 of the patient have mixed allergic rhinitis and
non-allergic rhinitis.
Non-allergic rhinitis.
So can I put it this way? So nerve is always there, like as a baseline, right? It's parasym and sym and sensory nerve. And both type of allergic or non-allergic, they all have the same neural pathway. So I think under the same umbrella of rhinitis, they all have some kind of neurogenic pathway. Either they experience a lot or not a lot, or not at all, right?
Quite similar to when you look at the nose, when the patient has nasal obstruction, you assess the nasal symptoms. You may observe nasal septal deviation, but actually for the airway, you should consider inferior turbinate. You should consider lateral nasal wall altogether about the nasal airway, nasal pathway. And then when you want to correct the nasal airway or upper airway remodeling, you should think about all structures. So when patients have rhinitis
Yeah.
or congested nose, you should think about allergies, sympathetic, parasympathetic, and sensory nerve, and neuromarkers.
Yeah, true. That's very correct. So when we see the endoscope and then we think like it's like edematous, clear water discharge, very inflamed, and usually we always say it's so inflamed,
Yeah.
and the word inflamed itself is already like a myth in some cases, right?
Yes, really, it's a myth.
Yeah. So some people don't have inflammation at all.
You access the histopathology.
Yeah.
There's no inflammatory cell.
Yeah. Oh, we have a guest. He wants to come in and get something.
Hello.
Go get it.
Okay, where are we? They do not respond well to corticosteroids. But one thing is, even the patient who have allergy test positive, they also have nerve. And when the patient have allergy negative, the doctors start to think that we cannot identify the allergens, but they do not think about the neurogenic pathway.
So
Actually, there's a receptor that, for example, when we expose to particulate matters, they can trigger the TRPV1 and TRPM8 and a lot of things. And then it can causes vasodilatations. It can causes rhinorrhea by stimulating the mucous gland and serous glands.
Yeah. I think one thing that the way I teach my student is that don't try to memorize the symptoms. Try to understand the pathophysiology behind it. So just like you said, the nerve innervates glands, and glands secrete secretion, causing rhinorrhea. And nerve also go to the vessels and also make it vasodilatation that cause the turbinate to enlarge, right?
Right.
Yeah.
And some guidelines just mention that if the patient have nasal obstruction, you give decongestant.
Yeah.
If the patient have rhinorrhea, they give antihistamines. If it's severely congested, they give intranasal steroid spray. But do you never think about
what's
the real
behind?
the
It's like you see the
pathophysiology?
tips of the iceberg, but you don't know what's underneath it. So I think the way we should really look at the patient is that you see the tip, but you also have to understand what's driving the tip to the top, right?
Yeah,
So
the unseen part.
yeah, I think it should be reinforced. All the students or physicians.
Otherwise, you become a symptomatologist, not a rhinologist.
Okay, symptomatologist. As I'm saying it right?
Yes.
Symptomatologist. Okay, that's not similar word for me.
Not us.
Okay. In your clinic, when you see a patient who might be suffering from neurogenic pathway, how do you tell them? How do you educate them? Because first of all, I think they will not be familiar at all of the word neurogenic pathway, or even like what's the matter. Was like, what? I never heard of it before. I've been told my whole life I have allergic rhinitis, and then one day, boom, you're not allergic rhinitis. I think for me, in my experience, it's quite challenging because when I see a lot of patients coming in with the same diagnosis of allergic rhinitis, and then one day I have to break the news that, oh, I don't think you have allergic rhinitis, so I'm gonna switch your medication. And they were like very alarmed that like, no, I have been having this antihistamine my whole life. Like, you're not gonna withdraw like my medication. Yeah, I think sometimes it's not easy. So how should we approach or tell our patients?
Interesting. Actually, when I speak to my patient, I also say about neurogenic pathway, but I agree with you that it's not easy to understand. But we need to explain more. What is it? And I will say weather is not allergen. Particulate matters. Okay, one word that is quite simple and easy is irritant. Right? They understand irritants.
So irritants is a cause of your symptoms.
Yeah, after you ask your patients what activate the symptoms.
Yeah, so it's very important to ask what triggers your symptoms, like at most important, because otherwise you get lost, right?
Right.
So what you usually ask your patients?
Especially when the allergy test is positive, but they say that their symptoms are aggravated by
Something
weather,
else.
smoking,
It's actually very
tobacco.
yeah.
Actually, it's not aggravated by the allergen, and I
Yeah.
would say that they are sensitized by the allergen.
Yeah.
They're not allergic to that particular allergen. Right?
I think this patient can be quite challenging, you know why? Because when the allergy test come positive, for example, in Thailand, like house dust mite is like, they allergic test on like almost all allergic patients. But when they say to us, they never mention about having the symptoms indoor. They said when they go out or when they like, season change, humidity change, temp change, and they experience this like congestion, like watery rhinorrhea, like profuse, and then it stops when like the weather becomes stable during the day. And then we start thinking, but I mean she have like allergy test positive, like you should give them intranasal corticosteroid. It should be like the best medication for them. So I think this group of patients kind of tricky because if you really dig down, like you gotta know that they're not really allergic to the house dust mite. So I think we have to ask more. What are the triggers, and then ask more and more, right?
Also, the symptoms.
The symptoms tells a lot, yeah.
Yeah. When they do not have itching, they do not have sneezing.
Yeah.
They do not have eye symptoms. They do not have any allergic comorbidities. You should consider maybe
But is
the
it
pathway.
true that patient with non-allergic rhinitis doesn't have any kind of itching or sneezing? Because I do think that patient also have some degree of itching and sneezing as well.
Yeah, right.
But maybe not a prominent one.
Yeah, but you just ask everything, right? And what symptoms suggesting you to allergy or non-allergy?
Okay, yeah.
And the other thing is when you use the nasal speculum using your headlight, you can see only the inferior turbinate, but you cannot see other structures.
Okay. So you said that endoscope is very useful in assessing the nasal airway, the nasal mucosa, and it gives a lot of information. So in the case of neurogenic rhinitis, what are you looking for?
Actually, I'm looking for excluding other diagnosis
It's
rather
almost
than
like exclusion, like the diagnosis of exclusion, right? Okay.
But when we say exclusions, most people exclude rhinosinusitis when they use nasal endoscopy. But the other thing is, if you look at the mucosa of the middle turbinate, it can suggest you if you observe edema, the general edema of the middle turbinate or polypoid or polyps. That suggests allergy.
Right. So it's almost like the diagnosis of exclusion. But actually, I think in some cases of non-allergic rhinitis or like neurogenic rhinitis, I see some mucosa that is not perfectly normal and also has a bit of polypoid or edematous change. So I don't think sometimes you cannot really differentiate between like allergy and non-allergy for like 100%. You have to correlate with the clinical always. Do you agree?
True. Yeah.
And also like the history of like taking antihistamine and it doesn't work. You still have profuse rhinorrhea. That's a very good clue, right? And also some patients already experience like ipratropium bromide spray. So I think if they, work good for them, it suggests a lot.
And when the patients are suffering from this and the doctors bring them to the theater, they try to reduce the size of the inferior turbinate. But they most of the time they do not think about neurectomy.
True, So which group of patients are good candidates for neurectomy in your opinion?
Severe nasal obstruction and severe rhinorrhea.
Severe rhinorrhea, right? Okay. And in your experience, when you do neurectomy, does patient like recover or like that the response rate of like decreasing the nasal discharge improve dramatically, or is there any circumstance where it does not work perfectly?
We will keep that to the next episodes.
I want to know now.
No, please wait.
You're so mean,
Follow
Professor.
us.
Okay, I think I want to come to summary and take home message for this episode, right?
Yeah.
I think like when you see rhinitis patient, we shouldn't think just about like allergic rhinitis or non-allergic rhinitis. You should think of the neural pathway as well, because there's many patients who still suffering from this neurogenic rhinitis,
Sure.
and we don't really acknowledge that much. So a lot of patients still suffering from it. So if you ever encounter patients who have this kind of symptoms and still not being, like they get the medication and still suffering, don't forget that posterior neural nerve is still a missing piece in your treatment. See you next episode. Bye.
Bye.